Hi, I'm Matthew Noble. I'm one of the shoulder specialists here at the Crystal Clinic Orthopedic Center. And in this video, we're going to be talking about ways we can prehab prior to our shoulder arthroplasty or reverse shoulder arthroplasty. There are certain things we can do that can kind of help us maximize our outcome after surgery. One of them is trying to increase our shoulder mobility prior to surgery. This can be extremely difficult in cases of arthritis or rotator cuff arthropathy, but the more motion we keep prior to surgery, it will allow us to maximize that again after. So we can see these stretches that I like prior to surgery in our shoulder stretches video, and that's a great one that you can watch here on our rehab page. Another important aspect prior to these arthroplasty cases is strengthening our deltoid muscle. This is extremely important in reverse shoulder arthroplasty, and again can help protection of our rotator cuff in an anatomic shoulder arthroplasty. The way we can do this specifically in cases where you don't have great motion prior to surgery is a simple what I call wall punches, okay? So you're gonna position your body up against the wall. I'm gonna place my elbow and wrist up against this wall, and I'm gonna load all three heads of the deltoid, starting with our middle head. And what I'm gonna do is I'm gonna drive my elbow into the wall. I'm gonna hold this for about 3 to 5 seconds, and I'm gonna do about 10 of these, okay? So then I'll relax, and I'll do it again, holding again 3 to 5 seconds. I like doing these about 10 reps, and I do that 2 to 3 times a day leading up to surgery, okay? We're then gonna load our posterior head of our deltoid. We're gonna position our back up against the wall. I'm gonna place my elbow nice up against the side of my body, and then I'm gonna drive my elbow into the wall again, holding it for 3 to 5 seconds, and then relaxing, doing it again. Now the last thing we do is we gotta get the anterior head of our deltoid, okay? So in this case, I'm gonna face the wall, and I'm gonna put my fist on the wall, okay? And I'm gonna punch into the wall, holding 3 to 5 seconds, and then relaxing, pushing it in again. I like these because again, specifically in cases where you don't have great motion prior, it can be hard to keep that strength up. This will condition that deltoid so you're ready for surgery. One thing that is extremely important for after surgery that I don't think we do a great job preparing patients for is teaching them how to get in and out of a chair. Now, some research shows that the number one thing that you can do prior to a shoulder arthroplasty is core strengthening, because you're gonna have to do your advanced daily living activities without one arm. So things that we don't think about is, how do I get in and out of a chair without pushing up? You naturally do it every day and you don't even realize it. So the important thing here is she's gonna show you that one thing I want you to practice is without using your bad arm, which is gonna be her right arm here, she's just gonna get in and out of a chair so she can use her good arm to push out and push up. And notice how she's getting her shoulders nice and above her knees, keeping that balance and coming down. Now she's gonna sit down for us also, showing us again, she's keeping this arm nice and relaxed. Normally it'll be in a sling, obviously. Now, if this is difficult for you prior to surgery, I want you to practice this daily. Do it multiple times. You can even do it just like you're doing your deltoid strengthening exercise. You can do it 3 times a day and do different sets. That's, again, that simple movement's gonna help strengthen your abs, it's gonna help strengthen your legs, and that way it's gonna come second nature after surgery. Now, very similar to getting in and out of a chair, we don't necessarily talk to people about how to get in and out of bed. Now, a lot of times shortly after shoulder surgery, you are gonna be more comfortable in a recliner, but some people say, hey, I can't sleep in a recliner, so sleeping in bed with a bunch of pillows stacked behind you may be helpful. But first thing is we have to get into bed. So what you're gonna see her do here is she's gonna drop down onto her good arm, she's gonna swing her legs up, she's gonna readjust, and then she's gonna kind of log roll herself into position. Again, obviously having pillows where you feel them more comfortable. Now, getting out of bed can be difficult too, because again, I don't want you putting any pressure on that arm. So she's sleeping in her sling like you should be, and you're gonna see her kind of roll herself onto her good arm. She's gonna push up with that elbow, and then swing her legs over, and then step out of bed. Practice this a couple times a day leading up to your surgery. Make sure that you are strong enough to get it done, and make sure that you have the motions down, because it will help you greatly after surgery.